All right, so have you ever caught yourself twisting your back in some crazy way, trying to get that satisfying crack?
Yeah,
We've all been there. And oh, I feel so good for like 5 minutes.
right.
But seriously, what is actually happening in our spines when we do that? Today, we're going deep, really deep, into the world of spinal health. And we've got just the person to guide us.
Absolutely.
Dr. Rory Dopps, a chiropractor with 20 years of experience, is here to share some seriously fascinating insights on why those DIY adjustments might be a little riskier than we think. And of course, what we can do instead to keep our backs happy.
It's funny, a lot of people, they think of their spine like it's like a simple stack of blocks.
Right.
But honestly, it's so much more intricate than that. You've got these like super complex joints, discs that are like shock absorbers.
Oh, wow. Yeah.
And then, of course, you've got this whole network of nerves branching out from the spine, controlling everything.
So it just really is a whole system.
It's a symphony. The whole body's connected.
No wonder it affects everything, how we feel overall.
Exactly. And even the slightest thing is out of alignment. Yeah. It can have like these ripple effects you wouldn't believe.
Yeah.
And that's where the term subluxation comes into play. Basically, it means one of the bones in your spine, a vertebra, is out of its proper place.
Subluxation. Okay, I'll admit that sounds a little intimidating.
Yeah.
Is it always like from a major injury, or how does that even happen?
Subluxations, they're actually way more common than you might think.
Yeah,
And you're right, sudden injuries, those can definitely cause them.
right.
But even everyday things can do it too. Oh, yeah. Think about it. You're hunched over your computer for hours.
Oh, yeah.
Maybe you slept in a weird position, or even just stress.
Right.
That tension can make your muscles tighten up and pull things out of whack.
So even if we think we're treating our bodies well, life just has other plans.
It's like life's throwing curveballs at your spine left and right. And the thing is, you might think, okay, one vertebra slightly off, no big deal, but it can mess with those nerve signals going to and from your brain.
Oh, wow.
And that's when you start seeing things like headaches, maybe some digestive issues, even feeling more anxious or just like run down.
Really?
Oh, yeah, it can show up in all sorts of weird ways.
Oh, it's like this chain reaction we don't even realize is happening.
Exactly.
And I'm guessing that's where that like urge to self-adjust comes in, right?
Oh, yeah.
People feel that tension. They're like, I just need to crack this back into place.
It's totally understandable. Our brains are wired to try and fix things ourselves.
Right.
But, and this is a big but, chiropractors like Dr. Dopps,
Right.
they spend years studying the mechanics of the spine.
Wow.
They know exactly how to pinpoint what kind of misalignment you've got going on and then use the right technique to fix it.
Oh, wow.
It's incredibly precise. I mean, you wouldn't try to rebuild a car engine without knowing how it works, would you?
Definitely not.
Exactly.
And I'm guessing twisting myself into a pretzel to crack my back is not exactly what the doctor ordered. So what's the worst that could happen with that? Like with those DIY attempts?
I mean, look, sometimes it seems harmless, and for some people, that might be totally fine. But you're playing with fire. Take that lower back twist everyone loves to do.
Oh, yeah.
If you don't have the right technique, you could be making things worse, straining your muscles, even risking a slipped disc. It's not worth it.
Okay, you officially convinced me. Hands off the at-home adjustments. So let's talk about the pros. Why should someone see a chiropractor, and what should they expect during a visit?
So it's all about restoring balance.
Yeah.
Like a tune-up for your spine. They're not just going to crack your back and send you on your way. They'll look at your posture, see how well you can move, talk to you about your lifestyle. It's very personalized.
So it's not like a one-size-fits-all approach, like with trying to adjust it yourself?
Nope, not at all. And even within chiropractic care, there are a bunch of different techniques.
Oh, really?
Oh, yeah. Dr. Dopps might use something called diversified, which focuses on getting those joints moving again through specific adjustments. Or there's Gonstead, which uses more precise adjustments to target very specific areas of the spine.
So it's about choosing the right approach for what your spine actually needs.
Exactly. It's all about understanding the nuances and getting to the root of the problem, not just masking the symptoms.
So no more DIY back cracking. Got it. But what can we do between those chiropractic visits to keep our spines in tip-top shape? Because I'm guessing it's more than just avoiding heavy lifting and sleeping on our backs.
You got it. It's not just about what you don't do, but what you actively do to support your spinal health. And Dr. Dopps is all about empowering his patients with the knowledge to do just that.
So it sounds like we're not just stuck with whatever our backs decide to do. We actually have some control here.
Exactly.
I like that. So what are some of the things Dr. Dops recommends to, actively take care of our spines?
Well, one of the best things you can do, and this is huge, is strengthening your core.
Okay, core
And
strength.
and I'm not talking about like getting a six-pack right.
Right.
This is about those deep abdominal muscles, the ones that basically act like an internal corset for your spine.
Oh, okay.
Yeah, supporting it from the inside out.
So it's like building that solid foundation.
Exactly. And you don't need to spend hours at the gym either. Dr. Docs, he's a big fan of planks,
Right.
where you're holding your body straight, and
Yeah.
bridges where you're lying on your back and lifting your hips. Those are great for really targeting those core muscles.
Okay. Planks, bridges, I can get behind that. Those are doable. What about flexibility? Because I've always felt like stretching is good, but how does that play into a healthy spine?
So imagine your spine, right? It's like a bunch of gears all connected.
Okay, yeah.
If those gears are stiff and they can't move well, movement is going to be limited.
Okay.
And that's when you run into those subluxations we talked about.
Right, right.
Yoga or even Pilates can be fantastic for this.
Yeah, those make sense because it's all about moving your body in those different planes.
Exactly. You got it.
Yeah.
Increasing that range of motion.
Right.
But even if you just add in some simple stretches throughout your day, that can make a world of difference. Cat-cow, for example.
Right.
Arching and rounding your back.
Yeah.
Or child's pose, which just gently stretches out the spine. Those can do wonders.
Yeah, so it's almost like giving your spine those little moments of love throughout the day, not just when you're on the mat.
I love that. Little moments of love, yes. And here's something else that Dr. Dops talks about a lot that I think people don't consider enough, and that's ergonomics.
Ergonomics.
And I know it sounds kind of fancy,
Right.
but really, it just means setting up your workspace in a way that actually supports your body's natural alignment.
Okay. So it's not just about how long we're sitting at our desks, it's about how we're actually sitting.
Bingo. Think about it. If your chair's too low
Mm.
or your monit's too high,
Right, right.
you're constantly straining your neck, your shoulders,
Yeah,
and over time, that's going to cause problems.
it makes sense. Okay, so give us the goods.
Yeah.
What are those ergonomic must-haves that we should all be thinking about?
Well, first and foremost, a good adjustable chair. That is key.
Okay.
You want to be able to adjust the height, make sure you've got good lumbar support.
Yes.
Speaking of lumbar support,
Yes.
don't underestimate the power of a good cushion.
So I'm picturing a supportive chair, maybe a standing desk for when I need to stretch my legs, and a really good lumbar support cushion. What else?
And your monitor, that's a big one. You want that to be eye level so you're not always looking down.
Right.
A monitor stand can be life-changing. And here's a bonus tip. Take breaks, get up, move around, stretch. Your spine will thank you.
I love these practical tips. So we've got core strength, flexibility, ergonomics. What about like what we eat? Does that play a role in spinal health too?
100%. Dr. Dops is all about the holistic approach,
Of course.
and that includes what you're putting into your body.
Yeah.
One of the things he really recommends is incorporating omega-3 supplements.
Oh, omega-3s. Yeah. I've heard of those. They're good for your brain, right?
They are. They're amazing for your brain.
So how do they help your spine?
Well, think of them as like these tiny little inflammation fighters,
Okay.
helping your body move more smoothly, more comfortably.
Yeah.
Inflammation is normal, but too much of it can lead to all sorts of pain and stiffness, especially in your joints.
It's like giving those joints some extra love from the inside out.
That's a great way to put it.
Yeah.
And speaking of extra love, Dr. Dobbs really stresses the importance of that ergonomic support we talked about, especially now with so many people working from home these days.
Right. Yeah.
I'm talking about adjustable chairs, sit-stand desks, monitor stands, and of course those lumbar support cushions. A well-supported spine is a happy spine.
Okay, sold. I'm redoing my home office. So any advice for picking out a good lumbar support cushion? Like what should we be looking for?
You want something that provides firm but comfortable support for that natural curve in your lower back. Reading reviews online can be super helpful. You're looking for something that has great reviews, and it should say that it's designed for ergonomic support.
Gotcha. A highly rated lumbar support cushion, check. This has been amazing. I feel like I've gone from nervously cracking my own back to actually understanding how to take care of my spine for the long run.
And that's what it's all about.
It's amazing how much power we actually have over how our backs feel.
It really is.
So as we wrap up all this amazing advice from Dr. Dopps, what's the one thing you really hope sticks with our listeners?
Honestly, I think the biggest thing is just remembering that our spines, they're not just something we think about when they hurt.
Right.
They're a part of us.
Yeah.
It's about making those little choices day after day that add up to a healthy back for years to come.
I love that. It's not about being scared to move or freaking out about every ache and pain.
Exactly.
It's about being proactive, thinking long term.
Yes.
Okay, so to recap, no more DIY back cracking. We're all about core strength, good posture, maybe tossing some omega-3s in our smoothies. Anything else we should be keeping in mind?
You nailed it.
Yeah.
And, one thing I see people get caught up on is this idea that they need to change everything overnight.
Right, yeah. It can feel overwhelming.
Exactly. But honestly, even just picking one or two of these things and adding them to your routine, that's huge. Start small, keep it consistent, and listen to what your body's telling you.
It's a journey, not a race.
100%.
And like any good journey, it's way more fun when you're not in constant pain.
Tell me about it.
Okay, so listeners, here's something to think about. Our bodies are always adapting, right?
Always.
So, what's one tiny change you can make today to show your spine some love? Maybe it's finally swapping out that old office chair or trying that cat-cow stretch during a break, or maybe it's time to book that chiropractic appointment. Whatever it is, take a step towards a happier, healthier back.
Right.
And until next time, keep exploring, keep learning, and keep diving deep with us.